Hello, my name is Sam Evans, and for my fourth Sports Medicine 3 project, I decided to focus on stimulants in sports and how it affects the human body, and how they affect the human body. What are stimulants? So, stimulant is a name that covers a variety of different drugs, including those that increase activity of the central nervous system, the CNS, as well as the body. Stimulant drugs are a class of psychoactive drug that provides temporary improvements in physical or mental functioning. When an athlete takes stimulants, their overall goal is to just elevate their mood, reduce tiredness, increase alertness, competitiveness, as well as aggression in their sport. Stimulants are also commonly referred to as uppers, and basically they just speed up the body's system by allowing more blood to flow to the brain. Stimulants are widely used as both recreational and prescriptional drugs. A healthcare provider may prescribe a stimulant drug to treat narcolepsy, promote weight loss, treat ADHD, or even clinical depression. Effects over time. Over time, stimulant drug abuse can mess with the brain's dopamine system and eventually cause the user to not feel any pleasure at all. Stimulants in sports. Stimulants are most common in high-contact team sports such as ice hockey and American football, as well as sports that require quick reaction time such as baseball. There was actually a survey taken in 2007, and reportedly 6% of college athletes self-reported using stimulants to increase their athletic performance. Since then, the numbers have just been rising up and up in all sorts of different levels of sports, including high school, college, as well as professional sports. Methods of using and testing. So the most common methods of using stimulants include pill form, snorted as a powder, injected with a needle, or even smoked in crystal form. As for testing, the presence of stimulants in the body can be tested using urine tests. However, there's a variety of different procedures as well. Let's talk about some of the most common stimulants. Up first, we have adderall. Adderall is a drug that athletes may use to improve their focus, increase their dopamine levels in the brain, as well as increase alertness, aggressiveness, and attention, and even reaction time while playing sports. Some think that it can even enhance hand-eye coordination. Adderall is an originally prescribed drug for people who have ADHD, just to help them focus and stay down to earth more. What about some of the negatives of Adderall? Some of the negatives of Adderall can include appetite loss, digestive problems, rapid heartbeat, dry mouth, head pain, as well as sleep issues. And Adderall is actually banned from virtually every sports organization unless you need Adderall for a medical purpose. Up next, we have nicotine. Nicotine, along with caffeine, is considered one of the most used psychoactive substances in the world. It is actually more potent and more addictive than caffeine. Athletes use nicotine or may use nicotine to speed up the messages traveling between the brain and the body, which can then result in faster reaction time and better alertness, as well as it releases adrenaline and reduces anxiety in the athlete. As far as negatives go, dizziness, headache, nausea, abdominal cramps, as well as possible vomiting and weakness. And if nicotine is inhaled using lungs, it can cause future respiratory problems and lung problems. As of right now, nicotine is legal in sports because even sports people claim that it helps prevent dry mouth, control body weight, and improve concentration and attention. Up next, we have caffeine. Most popular form of caffeine includes coffee and energy drinks. Athletes take caffeine to increase the circulation of chemicals that give them energy to the body, also to just keep them more awake and alert. Some of the major negatives of caffeine can include decrease in hand steadiness. There can also be withdrawal symptoms. If someone is addicted to caffeine and they go a while without it, it can cause withdrawal symptoms, as well as it's super addictive. As of right now, caffeine is legal in sports to proportion. If someone drinks way too much caffeine, then it is considered illegal in sports. Smelling salts. Smelling salts are a combination of ammonium carbonate and perfume. Traditionally, doctors would use smelling salts to help revive people who have fainted. However, today athletes are looking to improve performance with using smelling salts for their stimulant effect. The stimulant effect of smelling salts is due to ammonia, which irritates the person's nasal and lung membranes when they sniff it. The result of that is a person involuntarily inhales and starts to breathe faster, which sends more oxygen to the brain, which will then increase athletic alertness. Smelling salts have a very long history, and they were used in the past. What about some of the negatives of smelling salts? Smelling salts don't really have many negatives, except for the fact that if the athlete isn't ready for the putrid smell, they might jerk their head back, which can cause neck and back injury. As well as if the smelling salt is too close to the nose, the concentrated exposure can damage the nasal membrane. As of right now, smelling salts is legal in most sports, but not all sports. Next, here are some of the other stimulants that are quite common, but they're definitely more extreme than the other ones. Starting off, we have cocaine, methamphetamine, ecstasy, amphetamines, epinephrine, or like adrenaline, and many more, but these are just the most commonly used. All of these can be very addictive and have some serious negative effects, including rapid heart rate, unusual behavior, tremors, heart attack, insomnia, tooth decay, brain damage, organ damage, and can even lead to sudden death. All of these are illegal in sports and should not be used by any athlete. Conclusion. Overall, doping with stimulants is a real public health problem, and all coaches should inform their athletes on what stimulants are and what doping is, and just why you should stay away from it, not only for what it can cause in the sport, but as well as what it can cause in the long term. Here's my works cited. Thank you for watching.